11:03 a.m. Also saw in the chat, it looks like we have an awesome representation from everyone all across the state, all the way up into the Upper Peninsula. So that's really awesome to see. So good morning, everyone. I'm not sure where everyone might be located. I am kind of in the middle of the mitten, right? Mid-Michigan area, Lansing, to be a little bit more specific. Definitely snowy, definitely cold. But let me tell you, I was very happy that they did not close the schools again today. So thanks all for joining this seminar this morning and for taking your time out of your day to be with us. My name is Megan Gibbs. I am the Director of Customer Success here at MyHin, and I'm really excited that I have Joanne Jarvie here, also from MyHin, Brad Whittle and Zara Fritz from Blue Cross Blue Shield of Michigan, because we really want to take the time out to tell you a little bit more about MyHin, tell you a little bit more about Blue Cross Blue Shield, but more importantly, how you all and your skilled nursing facilities can be part of the statewide network in exchanging data across, I mean, really the entire state of Michigan. So regardless of where you're located, we are here to help you route your data. And then also we have our Blue Cross Here team today to help give a little bit more insight to their Pay for Performance Initiative program. So Katie, next slide, please.
Well, what if we go find Raina?
I think if we can check our microphone, sorry. Okay, so again, like I said, Megan Gibbs, Director of Customer Success. I also have Joanne Jarvie. She's the other individual that I can see on my screen that has her camera on. Joanne is our Senior Director of Network Growth and Development. So their team is really heavily involved with all of our customers and especially our new customers or those that are seeking to understand and learn a little bit more about MyHin. Whereas my part of the world is more on the operations side of the house. So our teams work very closely hand in hand. And then also of course, our partnership with Blue Cross Blue Shield of Michigan. So we have Brad Whittle here today, who is the manager of Health Information Exchange, also known as HIE, and Zara Fritz, who is the senior healthcare analyst. So both are extremely knowledgeable in all things pay for performance. Both work with our hospitals and provider organizations, skilled nursing facilities, you name it. Both excellent resources, and I'm so happy that they are able to join us today. Next slide, please. So for our agenda, we'll take a little bit of a deeper dive into explaining who exactly MyHin is, right? What is the Michigan Health Information Network and how do we support you? How do we support the state? More importantly, how do we support the Health Information Exchange Initiative from that statewide perspective? Brad and Zara will give a little bit more in-depth overview of the skilled nursing facility pay for performance program, as well as the reward opportunity that those skilled nursing facilities have access to. We will also give a little bit more information about the benefits and impact of the MyHin network and truly what it means to participate. You know, I think it's just one thing to say, oh, well, we can share data, but what does that really mean? What does it look like? Who gets the data? Who sends the data? So definitely a little bit deeper dive into, again, how MyHin can support that data exchange. And then we'll just give, I think, a little bit a teaser, tip of the iceberg, where we'll talk somewhat high level. We won't go into in depth about the ADT or the admission discharge transfer notifications. And then we have time designated at the end for Q&A. So that's not to say that if you have a question while we're talking about something, please feel free to utilize the chat. I know that it's monitored by multiple folks from the MyHin team. So we are happy to address any questions, or if there are any questions at the end, we can also talk about those as well. And then we'll also give a little bit more insight as to the part 2 of this meeting series. So without further ado, I'm going to hand it over to Joanne Jarvie to take it away.
After all this time, you would think that I wouldn't be muted. Hi, thank you so much for being here. We really are thrilled to have you. Gosh, I mean, we talk about SNFs, we talk about skilled nursing, we talk about you guys all the time. And now you're here with us. So thank you for being here. Very quickly, MyHin, Michigan Health Information Network, is a nonprofit organization. We are here to serve Michigan, the state of Michigan, its people, its healthcare ecosystem, and its governing bodies by acting as a backbone technical infrastructure for Michigan's health data exchange, prioritizing the health of all Michiganders, making sure that no one company, no one sector, no one body owns or controls everyone's personal health information. We integrate data from diverse stakeholders, including providers, pharmacies, health plans, and soon, and maybe, maybe you're already participating, but we are looking to integrate skilled nursing facilities into our network deeply. And that is why you're here today. We do this in Michigan by aligning policies and financial incentives and through real-time data sharing to foster collaboration and ensure that even the smallest providers or organizations can participate in this healthcare, digital healthcare ecosystem. As a neutral, collaboratively governed steward of health information, MyHIN exemplifies how technology can transform systems to improve health equity and access. Next slide, please. The goals of health information exchange broadly. So guys, MyHIN is a health information exchange. Did you know that there is a health information exchange in almost every state? Did you know that there are health information exchanges that are consistently and deeply working in many different ways under HIPAA to exchange data for treatment purposes, for payment purposes, and for healthcare quality purposes. So my mind was blown, like when I heard that HIEs even existed. So if this is a new paradigm for you, welcome. The goals of health information exchange broadly, and certainly for MyHIN, are to reduce inefficiencies in the healthcare ecosystem by enabling seamless and secure sharing of data across providers using disparate technologies. It aims to enhance the quality of care and health outcomes through better coordination and data-driven decision-making to lower overall healthcare costs. MyHIN ensures participation from smaller providers, health plans that often, and organizations maybe like yours that often lack the budget or infrastructure to easily connect. This inclusivity is vital since the market features over 500 ambulatory EHRs and vendors, sometimes leaving smaller organizations underserved by our model. HIE also aims to, in the end, support more personalized medicine, more personalized care, being able to give information to the people that care seekers trust to have it. And these goals collectively ensure a more efficient, equitable, and patient-centered healthcare ecosystem. Next slide. So here's a quick sort of, this is what it would look like if we weren't here, and here's what it looks like that we are here. We serve as an information hub. Again, connecting disparate EHRs, disparate parts of the healthcare ecosystem, enabling primary care practices, emergency departments, pharmacies, public health, and SNFs to access critical health data in real time. MyHIN receives health information from a wide range of stakeholders. We are here today to ask to receive data from you, to exchange. The information that we receive from you is matched to the appropriate human being and shared with all those caregivers who care for the same human being. We ensure that that only authorized users can access this data, and we provide for secure, private, and legal exchange of critical health information. Next slide, please. Again, I wanted to really hone in on the first step for SNFs with HIEs. What we are talking about in this series and what we are asking you today is to please get connected so that you can send us your ADTs, so that you can send us your admit, discharge, and transfer notifications to exchange through the network. And this is just a really quick sort of look at how it works. And we're going to get into it more deeply later. But remember, I said that we are so lucky to be working in Michigan and to be able to align, like we said, align all of the stakeholders that are being served by this shared
Hold on one second.
infrastructure to provide incentives, to provide for policies that enable this real-time data sharing. And I am thrilled to be able to give you a really good example of that. Next slide, please. I am happy to introduce our partners at Blue Cross Blue Shield to talk about how they are working to incentivize your participation in our network. Brad, hi.
Hi.
Thanks for being here.
Oh, my pleasure. Thanks for having me, and thanks for including Blue Cross in this conversation. As they mentioned, we have Zara Fritz on the line too. She's on my team, and she handles a lot of the administration of this pay for performance program that I'm going to talk about. And some of you may even know her and have communicated with her. But thanks to everybody for being on this call. Just want to follow up on some things that Joanne said. She mentioned that pretty much every state has a health information exchange, but I want to highlight the fact that MyHIN, the health information exchange in Michigan, is head and shoulders by far one of the best in the country. So when you engage with health information exchange in Michigan with MyHIN, you're dealing with some of the best, brightest people in this space. So it's not just we have an HIE in Michigan and it's just this kind of necessary evil or whatever. No, we have one of the best in the country. So I just want to point that out. They're too modest to say that, so I'll say it for them. Okay, so again, kind of the punchline up front. We're asking for kind of an initial engagement with MyHIN for a skilled nursing facility. It kind of looks like the first step, sending those ADT notifications that are generated when someone is admitted, discharged, or transferred from your location. That notification, when it makes its way to MyHIN takes that and they determine who needs to know. So and I'll tell you, I deal with primary care physicians and physician organizations on a daily basis. And the biggest thing they want to know is we need to know in real time or as close to real time as possible when one of my patients is admitted to a facility or discharged from a facility. And that includes skilled nursing facilities. So we put together a reward program to help facilitate that because we know there might be cost involved. Typically this is handled by your electronic health record vendor. So if you have no idea what we're talking about, you can just go to your EHR vendor and say, hey, are my ADTs going to MyHIN? And they will probably know. And I also want to point out that we're not throwing this out here as this like brand new fledgling concept. A lot of skilled nursing facilities and a lot of you on the phone right now might already be doing this and might have already been doing this for years. So this is, but this is a good opportunity for me to come in front of you and say, here's the program that we have. This program has been around for, I think, close to a decade. And there's some folks in the SNF community who maybe have never even heard of it. So I am going to go ahead and talk a little bit about the design of the P4P program. We call it the P4P program. It stands for Pay for Performance. And really what it is it's a very simply designed program that provides rewards for skilled nursing facilities who actively send their admit, discharge, transfer notifications to MyHIN. It's as simple as that. So who's eligible? It's absolutely every licensed skilled nursing facility in Michigan that's contracted with Blue Cross Blue Shield of Michigan. If you take Blue Cross patients and you're contracted with us, you're automatically, quote unquote, enrolled in this program. And what enrollment means is we do an analysis twice a year of every SNF in Michigan, and we look and we see, are you sending ADTs to MyHIN? If you are, you're given the reward. If you're not, you don't get the reward. It's as simple as that. So the reward itself is a 4% 4% increase in your per diem rate. And that applies to all of your Blue Cross commercial business, which includes traditional PPO and Blue Card members. Blue Card are the people who have a Blue Cross Blue Shield insurance card from another state. So it's not just Blue Cross Blue Shield of Michigan. So that's the eligibility. That's how that works. Payment timeline. This is how it works. So semi-annually, we do an evaluation. Like I said, twice a year, we evaluate to look and see who is sending ADTs to MyHIN. Based on and we base those analysis on a snapshot report that we get from MyHIN. So I highlight that because if there could be situations where maybe you're pretty sure that ADTs are going to MyHIN from your facility, but it doesn't hurt to check with MyHIN to make sure that they are actually receiving record of that and they can tie those ADTs to your facility. That can be a challenge sometimes. So you want to make sure that MyHIN has full awareness that you are sending your ADTs to them. And if they do, you'll show up on the snapshot report and you'll be included in this reward. There's really nothing you have to do with Blue Cross to be enrolled in the reward. You just need to be sending those ADTs to MyHIN. And this is kind of how the effective dates work. So we do the evaluation on February 15th of each year. And if you're in the list as compliant, you receive the 4% increase for the next, basically from April until March of the year after that. And then we do a second evaluation on August 15th. And that's for maybe a skilled nursing facility maybe that didn't make it in under the wire for the February 15th. There's another one in August, and you can get the incentive effective 10/1 of the current year through March 31st of the next year. And so that's really the long and short of how it works. Now, when we talk ADTs, and ADT, as Joanne mentioned, and we can go to the next slide. We don't have that slide here anymore. Oh, well, we're going to do that on the next call, I think, where we talk more in detail about ADTs. Anyway, within the ADT, there are a lot of different fields that talk about who the person is, where they live, who they're, what the date of the admit, the date of the discharge. There's different fields that we're concerned about, and we have the details of all the fields that need to be completed on those ADTs. We have that in our P4P guide, and those are publicly available, and we can send that out after the call if anyone needs it. But anyway, so that's my bit about the reward program, and I will turn it back over to MyHIN to talk more about what they do.
Thanks, Brad. I know there's a lot of good engagement in the chat, and we absolutely will get to it. Let's go to the next slide.
Really quick, I do have Brad's other slide. Do you want me to bring that up? I apologize, Brad. You want me to hit on that really quick?
Maybe for any of the
Yeah.
folks
Give me
who
1
might
second. I'm gonna switch my screen really quick. Everybody can just be patient for 1 second. There we go.
And as she's bringing that up, so the reason I like to just at least show this, you don't need to like absorb it and memorize it, but when we say that we engage with the primary care physicians in the state all the time, and one of the biggest asks is we need to know when someone was admitted or discharged from a facility, including a skilled nursing facility. There's a lot of good information in the ADT messages that if you were, imagine yourself in the shoes of a primary care physician, this would all be really good information to know. You have information about the sending facility, and they'll get into more details about OIDs and stuff. Don't worry about that right now, but you have the patient name, the patient demographics, and basically when and where they were. So this gives a little breakdown of the details of what's in an ADT. So anyway, that's it. We don't need to belabor it any longer. I just wanted to show you the types of information that come across in an ADT. And that's it.
Yeah, and this is a plug to come to our next one, and we're really going to dig into the technical aspects what information is included in this data flow. So stick around today, but we will be really going into it next in February. So a lot of, so here we are, we're asking you to do stuff and you're like, well, you know, what is in it for me? What's in it for me, guys? We're all busy. We're running businesses. We're trying to take care of our patients. Gosh, like why should I do this? So besides the fact that Blue Cross Blue Shield has generously created a supportive payment environment, you know, we are looking at helping to convene to create a more supportive payment environment, right? A more supportive regulatory environment for you all to be able to participate in the exchange of critical information to create shared decision-making around taking care of human beings. And the way that you work with a health information exchange, the reason, you know, sort of our capabilities, we send information, we receive information, and we make it available for you to either receive it directly into your source systems, or you can find it in one of our, you know, in other tools. We can make it so that you can find this information and use it. And being able to sit sort of in this middle ground creates really good outcomes for humans, for individuals, but also at organizational levels for public health, for human services, for providers, for payers. Next slide, please. So what's in it for you, right? Again, we are asking you today to start participating, to send data. But we believe that if you also deeply participate in the receiving of data, in the finding or accessing the network data, we believe that doing so will help you transform patient care. We can provide you access to comprehensive patient history, including prior treatments, current conditions, details on the level of care received before admission. Maybe we have accurate medications. We can ensure that all chronic care and hospital prescribed medications are accounted for. We really aim to help you reduce errors and adverse reactions. The critical information that we exchange is to help you streamline your transitions of care, to help you improve your care coordination. So beyond just sending, right, you can also receive. What information do you need? Where are your blind spots? And are those people already attached to the network? We think they probably are. And if they aren't, I've got a whole team, and our job is to go out and get them. So beyond, again, today we are talking about you taking the first step to send. And what we are where we'd like to get to is a bi-directional relationship of information sharing. Start to think about what information you need, what you don't have, and when you need it. And that's what we are here for. That's the benefit of joining the network. Next slide.
Actually, should we take a pause here? I know Megan has been answering some of the chats that have been coming through, but it might be helpful if folks haven't seen some of the questions. They might have the same question. I wanted to take a minute just to read some of those out loud, if that's okay.
Yeah, sure thing.
Okay, so it looks like there was a question of kind of from the start of, is there a cost associated with this process of sending ADTs to MyHIN? And is there a legal agreement that needs to be signed? So Megan, you went ahead and responded to that saying that MyHIN does not currently charge for SNFs to send ADTs to MyHIN. However, there might be a cost associated between the SNF and their vendor. And noted that our account managers can expand on this more directly with you. If you want to reach out to us, we'll provide everybody's contact information at the end of this. And we do require any organization participating with MyHIN to have the necessary legal agreements fully executed to support statewide data exchange. So again, in case anybody else had a question around costs associated or legal documents, there was that answer. There was also a question of if this recording will be shared. Absolutely, we will share the recording and the slides. Someone had asked if MyHIN is replacing patient ping and if we have a list of acute care hospitals that participate. Megan responded to that one as well, that MyHIN has not replaced patient ping. Patient ping is a vendor that does participate with MyHIN, but offers different services. And yes, we absolutely do have a list of hospital and acute care hospitals that are sending data to MyHIN, and we can share that list following the call.
It should be noted also, we invited patient ping and bamboo. I don't know if they're here. I didn't get to see. We invited a lot of your vendors here today, and they are an essential, critical part of this journey, and how they work for you and how they work to exchange information with your statewide health information exchange is their business. That's their business. And you have a relationship with them, and they usually have a relationship with us. But we don't want to not directly, as MyHIN, have a relationship with you all as the healthcare organizations. So we have to work with your vendors. We have to work on the technical connections here, but we need relationships with you to make sure that you're using this information in the way that you need it and that it is meeting your goals for connecting in the first place.
Great, thanks for that additional explanation, Joanne. It looks like Jason had a question in there, and I'm not sure it had gotten an answer yet, but
Sure.
Jason was asking how many SNFs currently receive ADT incentives.
Yeah, I can answer that. Hi, Jason. How you doing, man? Right now, we have 316 SNFs in Michigan are currently receiving the incentive based on our last check, which is close to 3/4 of SNFs in Michigan. So the number is climbing. For a long time, that number was always less than half of the SNFs in Michigan, and now through some really good work we've been doing with Point Click Care, we've gotten the number up pretty significantly. So that's pretty exciting. So yeah, this is, again, as I said before, this isn't something brand new, and we're asking people to be part of a pilot program or something like that. This has been around, and a lot of skilled nursing facilities, through the help of their EHR vendors, are contributing ADTs to MyHIN. So.
Thanks, Brad.
Yep.
Okay, and then John was asking if we could send a copy of the P4P guide with the recording and the slides. I think that would be perfectly fine, and we can do that. And then
I think there was a question about TEFCA.
yes, thanks.
Yeah.
Yep.
So MyHIN is pursuing a path to participate with a designated QHIN because TEFCA's vision for a secure network strongly aligns with our interoperability mission. We aren't there yet. And we have really kind of taken the position that we are going to wait and see how it directly supports you all, which would be a sub-participant in sort of the TEFCA vision. And there would be flow down terms legally when we make that decision. So we have been very, we've been very cautious. Should also note that to date, correct me if I'm wrong, anybody on here, but to date, QHINs, which are, remember I told you that there are these HIEs, and these HIEs exist. Sometimes they're regionally, sometimes they're statewide like MyHIN. And now the federal government has put a lot of thought and time and money into creating national networks. These national networks to date are not able to push information. ADTs, the way that they work best is when they are pushed to the people who need to know. The people that need to know wouldn't know that they need to know until the person shows up at their facility. So the larger question about TEFCA and these big health information exchanges, they are query only. So you only find the information when the person presents and when you ask for it. Ours has been a push model, and that push is the difference, especially when we're talking about ADTs. So I hope that makes sense. And I hope I answered your question. We are not yet participating in TEFCA. And we really would love, we've been hearing from some of our participants that have questions about it. Happy to talk to you about it. And certainly you would know because there are flow down sub-participant terms.
Thanks for that, Joanne. All right, looks like next there was a question around for SNFs that have multiple locations, is the agreement with the organization or each facility individually? And Megan answered this and said it really varies by each organization and how they're legally structured. So we would just ask that you reach out to us directly and we can kind of help field those questions and address anything related to legal agreements and associations. Gloria was asking if there's a cost for the platform that would be used to be able to see the timeline from these ADT feeds and the documents and data that was discussed. So Megan,
Yes, we have sorry, Megan, you want to?
I'm so sorry. I was just responding to one of the other questions. Which one are we at?
No, yeah, we have a product called My Gateway. And My Gateway is something that we created as a floor of a technology to support accessing this really critical information within our network. There is a cost for it, but it comes out to about, I think it's like $1 a day. So it's about $300, $380 per year.
okay. There was a question from Deepika. Is this a requirement for participation or is it purely optional?
Today, there are no requirements for you to participate. There are only incentives, and there's only the promise that by connecting and sharing information, you become a part of an ecosystem where you can access information.
And Maureen was asking if we can send a list so that way they know if they are on it.
Absolutely. Well, we will answer your question about your organization every time.
Then Sarah was asking if we can expand on the work being completed with Point Click Care. And I know, Megan, you spoke to this a little bit in the chat already, but I don't know if you want to speak to it a little bit further for the rest of the group.
So this is going to be, I think, like a multiple phase approach, which is okay. I'm not going to go too far into the weeds with that one. But I'm thinking in the next 2 weeks or so, we're going to have a subset of the skilled nursing facilities that are connected through Patient Ping. We'll begin sending ADTs to MyHIN. And then wherever there is what we call an active care relationship between that patient and the healthcare professionals that provide them with care, those ADTs will be routed outbound from the MyHIN systems.
You meant Point Click.
I'm sorry. Yes. Too many patient points. Yes. They're all kind of rumbling together at this point. But yes, we are going to have, I can't remember the number off the top of my head, but more skilled nursing facilities sending inbound ADTs to us in the next couple of weeks. And we would be happy to share the finalized list after those sites do go into production as well.
Great. Okay. Monica was saying that our EHR software is PCC and we are using the point click connect button to receive hospital information into our records. Is there anything else we should do regarding ADTs for MyHIN?
So this is about sending ADTs. It sounds like you are, you might be using something to receive ADTs. We're really, I'm not clear. And I don't know, do we have a representative from Point Click Care here today? I know I invited you all. I so hope you're here. And if you are, I would welcome you to come off mute. But in any case, do you have to do anything? You don't have to do anything besides die and pay taxes. But if you have PCC, your question to them is, are you sending our ADTs to MyHIN? And if not, what do we need to do to make that happen?
Monica, if you're on and want to come off mute, did that help answer your question, or was there anything more that you wanted to expand on with that? For me to put you on the spot, but if you're in a place where you would like to come off mute and
Sure.
expand on that, please feel free.
Sure, I'm off mute right now. So my
Okay.
question was, I do have the agreement with MyHIN. I have the button in PCC that I can hit and it downloads into my document section. And I'm going through and I'm getting authorization by responsible parties to turn on that section of PCC that allows us to do information sharing. Is there an additional step that I am missing to make sure that MyHIN gets the ADT?
Really,
I am missing.
yes, really, really good question, Monica. I would love to connect offline and make sure that you guys know exactly what you need to do. And maybe also we can get into this in our next one where we get super technical, but we have your email address and I do think it's important to follow up. I can connect you with our PCC contacts. I don't know exactly what it looks like for you.
Okay.
But I can tell you that we have been trying to work with Point Click Care for a very long time to make it easy for you all to share this information.
Thank you.
Thank you.
So we will make sure to follow up with you after and make sure that you have the answers that you're looking for. Cheryl was asking, is it true that MyHIN has an agreement with eHealth Exchange, which is a TEFCA QHIN, but not actively exchanging information?
Meg,
I
could or you
for the
could.
mute on that one. So yes, MyHIN does participate in eHealth Exchange. It's through something that we call our intelligent query broker. And so Shira, I saw your question and I was trying to respond, but MyHIN is participating with eHealth Exchange. We are actively onboarding organizations to participate in sending those queries through today. The reason why it shows that MyHIN is not participating is because we're not participating directly. We are participating through a node under the USQHIN, which is why it doesn't show, I think it says, MyHIN wasn't, but we are. So a little bit confusing, but definitely can confirm that we are able to participate with eHealth Exchange.
Should note also that eHealth Exchange predated TEFCA. So while we are participating in eHealth Exchange, we have not yet, eHealth Exchange is not our QHIN. It's, right now we are exchanging information under a different legal structure than the TEFCA legal structure. And for those of you who are literally just what are they talking about? That is so okay. It's more than okay. Because today we're really just trying to focus on what it means to our ecosystem that you all share when your patients are being admitted, discharged, or transferred. Megan, let's just jump a little bit into that if you could.
I'm so sorry. I was taking a note to the question. You mean you want me to jump into the next slides?
Yeah.
Okay.
And we'll get
Right.
to the rest of the questions too, either after the end of the presentation, or if we don't have time today, we have another session and we can follow up via email as well. So we're not going to leave you hanging.
Yeah, sounds good. All great questions. Love them so far. Okay, so we've been talking this whole time about your skilled nursing facility sending ADTs to MyHIN. And if anything, I'm fully aware that there might be some of you that have no idea what an ADT is. An ADT is the HL7 message type that stands for Admission, Discharge, Transfer, Notification Systems. So think that anytime you might have gone to the hospital to seek care, you brought your child in, you brought your grandma in, your mom, whoever it may be, that time that that patient is either pre-registered or registered in that hospital's EMR, it triggers what we call that ADT notification. And if that hospital is connected to MyHIN, which 99% of them are, I think we have a couple stragglers, but those ADTs notifications come to MyHIN, and MyHIN does our magic, and we route those ADTs outbound to the healthcare professionals that have an active care relationship with that patient. So if you think about not just when you're registered, but whether you transfer floors, or maybe, you know, the patient showed up unconscious and they woke up and now we're able to understand their name, their address, who their insurance provider is, we receive those ongoing ADT notifications and share them again with members of the patient's care team. There are, I think, over 50 different ADT event types, and MyHIN does not discriminate as to which event types we want to receive from your organization. Truthfully, we always say send them all, right? Because I don't think there's ever a time where MyHIN will want to dictate and say only these specific ADT event types are going to be useful. So we say send everything, right? Because then that helps build the full patient care longitudinal record history. And also kind of what Joanne was talking about earlier, reduce costs, eliminates gaps in care, things of that nature. But these ADT notifications are really used to communicate the patient status during the time of that encounter, that time that they're transferred throughout a different hospital floor, up even to the point that they're discharged, and they're generated in real time. So we're able to receive an ADT message in, and MyHIN processes that message in less than 1 second, and it's out the door. So with, you know, MyHIN being around for as long as we have, I think we're, if not hundreds of millions, I think we're actually in the billions of messages that are exchanged over the years. And now that you start talking about, you know, MyHIN receiving ADTs from hospitals, skilled nursing facilities, home health agencies, things of that nature, we have over thousands of senders that are sending us ADTs on a daily basis at any given time. So it really is a true representation of what's happening with that patient at any specific time. Next slide, please. So where do ADTs come from, right? I think we've said at this point, we have most of the hospitals in Michigan. When I say most, I'm excluding those that are like, you know, your surgical centers. I did see a question here about the VA. We're constantly working to get the VA connected to us one way or another. But think of all your larger hospitals and health systems, but then also those that are in the rural communities and your acute care hospitals. All of them are connected. They've all been exchanging data with us for a very long time. But we're thinking beyond hospitals, right? I think back to when 10 years ago, when I first started doing what I did, the main focus was always on the hospitals. And I've watched that evolve over time to where we had outpatient facilities sending us ADTs. And then that morphed into skilled nursing facilities, home health agencies, long-term care facilities. And we also have some provider organizations that do send us ADT notifications as well. So these ADTs aren't just limited to the hospitals or the skilled nursing facilities or things of that nature, but it's really any point that a patient can go somewhere to seek care. MyHIN, again, doesn't, you know, kind of like I said, we don't discriminate against the ADT event types. We don't discriminate who wants to send us data. And so we really want to build an impactful network where the focus isn't just on, is the data coming into the network? It's always, is the data coming to the network, and how MyHIN can work with these various sending sources and receiving organizations to make sure that the content of the data is where it needs to be. We want to know that The incoming data is helping the receiving providers close the gaps in care, reduce costs, things of that nature. But then also, how can MyHIN provide that assistance to the sending sources and that feedback to help kind of make those small improvements over time? So, I've seen lots of very positive change over the last 11 years, especially with Blue Cross Blue Shield's P4P and performance program, right? That's evolved too. New requirements came about. So it really is a true partnership in making sure that the data is not just being exchanged, but the quality of the data is top notch as well. Next slide, please. So kind of coinciding with the slide that Katie had brought up and Brad had gone over earlier, there's a lot of information that can be derived from an ADT. It's not just whether the patient was admitted, transferred, or discharged from any sort of healthcare facility, but start thinking along the lines of demographics, right? My first name, my last name, my address, date of birth, gender, my insurance information, my provider information, the reason I was, admitted to the hospital, what's my working diagnosis? Maybe they were able to tack on a final diagnosis. Where was I discharged? Was I discharged back to my home? Was I discharged to another medical care facility, a skilled nursing facility? There's data in there as to whether or not the patient unfortunately passed away. And if so, what's the death date for that patient, right? I think that's huge when you start talking about medication reconciliation management and making sure that fraud isn't being committed, right? There's so much information in an ADT. But I think one of the things, I'd be remiss if I didn't say that I think an ADT, if you look at a raw message, they can be scary. Raw HL7 messages are not easy to read by any means, but please, please, please reach out to MyHIN, because if we ever want to talk about your organization receiving data from us, we have a plethora of products and services that we can help kind of, make the information easier to interpret. But we do know the requirements that the sending sources have. We're able to provide guidance on what we're looking for in terms of those sending requirements. And like I said too, it's always an active, fluid, ongoing conversation. I don't think it's ever just very black and white to say, start sending this, right? There's nuances, which admittedly there's always going to be, I think, in healthcare information technology, but we have fantastic resources to help guide you through that process. And then also we can expand on more as to what information is required as part of P4P. But again, if, more is better, I think too, in making sure that the data quality is there as well. So why are ADTs important, right? I've talked about the various organizations that are sending, the amount of messages that are coming through. But one of the things that we've always been hearing, and even for the last couple of years from our provider organizations, is we want more SNF data. We want to know what is happening with our patients when they're being sent to the skilled nursing facilities. And so it's great, right? ADTs are important because it's more data, but it's also, I think the big one, and kind of what I've said a couple of times now, is reducing costs, right? We know where that patient is. We can do the patient outreach. Maybe we can coordinate with a skilled nursing facility to get that patient home faster. Also improving that patient's overall, I think, just like healthcare, right? And maybe we have to focus on readmissions or why they're constantly being readmitted to a skilled nursing facility. Can we offer different care? Can we offer new care? Then it's also making sure that the data is exchanged in real time in an automated fashion, but more importantly, it makes it very easy for the providers to kind of have that full longitudinal record history of what's going on with their patient, when and why, to be able to provide that next level of care. So really, yeah, Joanne, like you said, the real-time notification is a huge factor that plays into a lot of this. Next slide, please. So kind of just walking through the process again, I think this is a little bit of a teaser for our next session, but what do we mean when we start talking about the ADT notification process, right? And kind of based on the feedback we've heard. So Anne, in this example, she's admitted to the hospital. The hospital sends that ADT to MyHIN. MyHIN performs identity resolution. So you've heard me talk about it a little bit, but we utilize our active care relationship service to identify which healthcare professionals have that active care relationship with Anne. So once we do that, we do an internal lookup to determine how those healthcare professionals want to receive the data from MyHIN, and that ADT notification message is routed outbound. So again, all of this happens in less than 1 second. So if you take less than 1 second, multiply that by the hundreds of thousands of messages that roll through the system, it's a very, very fast process. Next slide, please. So we know that maybe in that case, Anne wasn't discharged to her home, right? She was discharged to a SNF, and that coincides with a lot of the asks that we have from our receiving organizations. So our expectation of the skilled nursing facility sending ADTs to us is that when Anne is admitted to the skilled nursing facility, that skilled nursing facility generates that ADT notification and it's routed to MyHIN. That same process follows where we identify her care team, determine how the care team wants to receive the ADTs from MyHIN, and then MyHIN routes those ADTs to Anne's care team or those that have that active care relationship with her. So again, they're notified Anne is admitted to the SNF, and now they know that they maybe want to keep a further or a closer eye on Anne's current care. Next slide, please. Not only do we want to receive the ADTs when Anne is admitted to the skilled nursing facility, but yes, we also want to know when she is discharged, because I think that's also important to know where she is discharged to. So in the event that she is discharged, or say if and when, same process, right? We identify members of Anne's care team, we route the messages to her care team based on their delivery preferences, and then that helps again close the gap, reduce costs, real-time notification of what is actually happening with Anne. Next slide, please. And so I know that I kind of went through that pretty fast, but again, I think a lot of that is also going to be discussed more in depth for our next session. Thanks, Katie. So this session, we wanted to utilize as a teaser, right? We can't really dive in and talk about how to do it without telling you who we are and what we're even talking about. So our next session is February 6th at 11 a.m. And I know I put it in the chat here. So please, please, please don't hesitate to reach out to myself, reach out to Joanne. If you have very specific questions regarding Blue Cross Blue Shield's reimbursement, if you qualify, anything of that nature, I think I would say, as much as Joanne and I would love to help you, Brad's your guy. Brad can fully answer any of those questions. And if we navigate into the territory that, specific questions might be more delegated to the MyHIN team, we're happy to step in. We also have a ton of information on our website, but we do want to see you back at the next section. So the next session, we'll talk more into about how you technically get involved with MyHIN, how you will send the data, kind of those key onboarding / operational milestones that have to be completed as part of that process, all the way up to the point where MyHIN can say, great, we're now receiving production data for your skilled nursing facility, and it's being routed to the various members that or healthcare professionals that your patients have that active care relationship with. So I'm going to pause there because I know we have 5 minutes. So I don't know if there's certain questions we want to touch on in the chat, if anybody wants to come off mute, but happy to answer any questions.
Hey, Megan, it's Brad again. I'm going to put Zara Fritz's email in the chat. So anyone who's asked if you're if you're already sending ADTs or if you're already receiving the reward for the SNF P4P program, if you have any questions like that, shoot an email over to Zara and she'll be able to look that up and tell you exactly whether or not you're actively participating. So I'm going to put that in the chat right now.
So beyond just these two webinars, you may have already received a survey. There are the state MDHHS and MyHIN and your partners in the ecosystem we want to know more about you. We want to know what's hard for you, what's easy for you, what you understand, what you want to do, what you're not getting in terms of information or data. And there is there is a statewide survey happening right now. So if you have received the survey or even have not received the survey, but you think you're the person that should, please, Joanne, reach out to me. Would love to make sure that you guys are, you and your organization are in the position to receive funding for technical assistance and training. Our state health department is really invested in investing in you, and they need to understand what type of help, what type of technical capabilities and training you all need, and they now have access to funding to help you, which is really exciting. 11:58. What an hour. I can't wait to see you back. You've got me, Joanne, you've got Megan, you've got Brad and Zara at Blue Cross Blue Shield. No question is, look, we will answer all of your questions the best that we can. And even if it starts with like, what's an ADT and who is MyHIN? We like those the best. Those are the better questions. The harder questions are others. Thank you for being here. Thanks for engaging. We'll see you next time.
Thank
Thanks,
you.
Joanne. Thanks, Megan.